Hi, I'm Dr. Faisel Syed. Welcome to another episode of Faisel and Friends. We're here because we believe everyone deserves access to quality primary care, and ChenMed needs physicians to take care of them. Tonight's topic is leading towards value. My co host and moderator of the chat is Dr. Dan McCarter. Welcome, Dr. Dan.
Hey, Faisal, it's good to be with you again.
How are you doing?
I'm doing great. We need more value in healthcare in this country, so I'm looking forward to tonight's conversation.
Oh, I am too. Tonight's friend is let's just welcome Dr. Don Crane. Dr. Don Crane, sorry, Mr. Don Crane. Welcome.
Glad to be here, Faisal. Good to see you. Good to see you, Dr. Dan. Nice to see you. I'm glad to be here.
Don, you have been CEO of America's Physician Groups for many years now. I'd love
21.
to, yeah, I'd love to hear your thoughts about what brought you to APG.
Well, Quirks of Fate did in large part, I must say. Long ago, there was a bankruptcy in Southern California involving Med Partners. I was the chair of the creditors committee. It was very association like. My position in then CapG, now APG, name change, became open. They interviewed me. They made the terrible mistake of hiring me, and they perpetuated that bad judgment for 2 decades. And so that's the quirk of fate. But indeed, I am passionate about the transformation of America in healthcare. That's what drives me. That's what I'd like to see accomplished. I know what opportunity lies before us, but I know what imperative is in our hands right now. We're not doing anywhere near what we could do, and there's some suffering that results. So there's your answer. I'm very passionate about transforming American healthcare.
I remember in the pre-show we were talking when I finished my residency training, I had absolutely no idea that there were different options with how you pay for medical care. I always assumed that you just pay for every visit or any test, just like you do like when you go to the mechanic. Otherwise, I mean, you just go to a free clinic for medical care. So, how do you believe we should pay for healthcare in the United States?
So we've all become sort of economists to a certain extent, and economic behavioralism. I mean, payment methodology makes a lot of difference. So you can pay people by the hour, you can pay them by the click, or you can pay them by the case, or you can pay them in advance as we recommend be done. This is our model. And so we are very much wedded to the notion that single payment is made for a defined population, very large, for a defined period of time, say a year, for a defined set of benefits, and that is prospectively paid, and it changes everything about care delivery once that's done. But it's key. Many things have to be done to transform our system, but that's probably number one at the top of the list, Faisal.
Yeah, we meet with independent independent physicians across the country, and when they hear risk, you hear especially full risk, you know, there's so much hesitation. And the first question is usually something along the lines of, well, don't you think we should just first figure out shared savings? And our response usually is, well, no, you got to just do it. But how do you overcome that hurdle?
Well, first you have to have some humility and some sympathy for it, because no physician shouldn't go to medical school to become insurance carriers, right? So the notion, the word risk seems somehow foreign and so on. But indeed, in 2021, we are and must be stewards of limited resources. If we exhaust financial and other resources, it will equate to denied care. It simply won't be enough access available for those that need it. So it now becomes part of our charter and our charge that we actually be stewards of the resources, and husband this money, et cetera, intelligently and not wastefully. Fee for service is wasteful, as I can elaborate in a minute. Prospective payment is not. And so, whether we like it or not, we've all got to pay attention to the payment model. It is indispensably important.
Now, first there's that mindset shift that must happen. But if you had to describe maybe the first 2 or 3 steps after making that shift in mindset, what would that be?
Well, what happens automatically is pretty quick. Everybody in the whole enterprise, physicians, mid-levels, janitors, executives, et cetera, all realize that at the end of the day, everyone's eating out, if may use a real crude term, living out of the same trough. And if at the end of the year there's no water in the trough, everybody dehydrates. And so we're all aligned in the goal of getting the job done, keeping the population healthy within effectively a budget. It happens to be a prepayment, could be a budget, and have the same sort of impact. But all of a sudden, everybody's aligned. And so all of a sudden, light bulbs are going on. Well, is there a better way to do this? And maybe the primary care doctor should do this and not send it off to, a specialist. Or maybe we ought to have a home visit to avoid 3 ER visits and the like. All of that thinking quickly permeates the mental states of everybody in within the enterprise. And so that's really the big answer, I think.
You know, it's so difficult because the data, I mean, even the records are not connected. My father was visiting my brother a couple weeks ago in Texas. He's still there in Texas. Because on the day he was supposed to come back, he was walking my brother's 90-pound puppy. He's got a one of those. He's got a year-old Great Pyrenees. The leash was wrapped around my dad's wrist, and his name is Comet. My dad was looking over at some deer, and Comet darted off at a dog and literally, tragically drug my father across the road and shattered my father's hip. Horrible situation. He's in San Antonio, Texas. We live in Tampa, and this is the day he was supposed to come back. And you can imagine, my father's in an emergency room in San Antonio, and he could have very well been in a tent in the middle of the jungle because they had no idea. Imagine the orthopedic on call has no idea about anything about his history, his allergies, and none of that. And he's in pain. So they're asking him, oh, he's like, yeah, I had stents placed years ago, and I'm a diabetic, and all they're hearing is, oh my gosh, we got to do this workup. So he tells me he's a Chen Med patient. I called his doctor, and I was in a panic. And I told him, I said, oh, Dr. Giwala, my dad's in the hospital. He broke his hip. I'm worried they're going to delay the surgery, and they don't know anything about him. And I said, do you have this? And he said, Faisel, stop. I'm drawing a line here. Moving forward, you're the son, I'm the doctor. And he got on the phone, called the hospital, got through to the on-call orthopedic, printed a PDF, my dad's last stress test, which was completely normal, his echocardiogram totally normal, EKG, blood work, and medication list within a matter of like 7 minutes, 6, 7 minutes. But he was able to do that because he's efficient and we have this culture of, delivering efficient care. But we're not there yet as a country. I mean, still, it's 2021 and you got to go through all this. If we would have asked for records, I was worried about somebody sending 700 pages of records to this orthopedic surgeon, and it would have taken a couple of days to go through it and say, "Oh, forget it. Let's just do the whole workup." What do we need to do to make this system connected?
Well, we need to organize it. Things organized work better than things disorganized. And so you guys were living examples of that. The payment model has a lot to do with that. So when all of a sudden some physicians are responsible for a population of, say, 50,000 patients, they got to get organized quick, and that they do. And pretty soon you have an enterprise that's connected with, for example, an EMR, centralized data system, centralized care management system, et cetera, et cetera. It's positioned to talk and to share. And everyone there works within the same medical record. It may be on a computer screen. So you have the ability to work together in a collegial team-based way. Now with, a remote location in Texas, it may not be with another Chen Med site, but it may also be on an Epic My Chart system, for example, for all I know, or something, let's hope, interoperable and compatible. And the press of a send all of a sudden makes the records available or sends them. But things organized, systems, systematic, organized enterprises have a way of delivering care under these circumstances where, with all due respect to Marcus Welby, I can't help but use him, an individual doctor paid in a fee-for-service world on the corner, he's not going to be able to do that. And that won't be able to happen. And so organized systems, good. Payment model, good. other things that come out of it also good.